I'm Stacy, and I'm here at Klepzig Natural Healing Clinic, and I'm sitting here with Dr. Klepzig. And I'm coming to you as a new patient of Dr. Klepzig's. I was able to visit his office today, and I have a couple questions for you. You mind if I ask?
Yes.
Okay, first off, I'd like to start off by asking you a little bit about all these letters behind your name on this card.
Okay.
So can you tell me what all of these licensures and degrees are?
Sure. The first licensure is I'm a chiropractic physician.
Okay.
Graduated in 1997, so I've been doing it for a while at this point. I am a chiropractor, but I don't practice chiropractic anymore in the office. But as far as the training that I have, that's where I get my Western medical training from. And the second part is my certification in acupuncture. So I'm a board certified licensed acupuncturist.
Okay.
So I'm trained in both Eastern and Western medicine, and that combination has my brain working a little bit differently. Sometimes we can pick up things we wouldn't some other way.
And what comes next?
It's a CCN, which stands for Certified Clinical Nutritionist. So I'm interested in what you're eating, and and I'm also a certified herbalist. So from a therapeutic standpoint, we're looking at food is medicine, and then nutritional supplements as well as herbal supplements to bring the body back in balance.
Okay, great. So how do you blend these modalities together?
Sure. I don't practice chiropractic anymore, but I do practice acupuncture on a daily basis. And of course, I still use a lot of testing methods that are Western medicine based. We do saliva testing, and occasionally blood testing if we need it. If someone needs to be sent for an MRI or an X-ray, we'll take care of that. I don't obviously do those things in the office. But my primary mode of testing involves an acupuncture technique, which is kinesiology or muscle testing. So it's an energetic method. And in Western medicine, we're looking strictly at the biochemistry. And in Eastern medicine, we're looking more at the energetics as well as the biochemistry. So combining that information that we can get kind of gives you sometimes an exponential look into what you're seeing from multiple views.
So that's a little mystery behind kinesiology and muscle testing.
Yeah.
And knowing that I'm going to be in that little room of yours, tell me what to expect as a patient when you first start to assess me.
Sure. Well, initially, we're just going to sit down and we're going to spend 10 or 15 minutes talking about what's going on. And I have quite a bit of paperwork that I have patients fill out, fairly extensive, because the details matter. And I will spend time later on all those details, but first I just want you to talk. I want you to share your story, give me an idea of what's going on, where it started, and how long it's been going on for you. And then I'm going to do an exam. And my exam's going to seem a little different to people because the kinesiology or muscle testing component is about having a strong arm, and I'll pull on that, and we're going to touch acupuncture points or use homeopathic vials or test kits to see what kind of weaknesses I can find in your system and what sort of holistic methodology we could use to balance that back up.
Okay.
I get it. I understand that this is so new, the way that I'm testing, but all we're doing is using a technique to help sort out the data, because there's a lot of information here.
Right.
And
there's a lot of information
here. A lot
here.
of information, yeah. And so when we're looking at it from a standpoint of just Western medicine, we're just looking at the biochemistry. We're looking at the numbers, and that's all important, especially if you're sick and you're ill, and we need to manage that process. But there's this zone where over here you're completely well, and over here you're really sick. And so the best methodology for measuring that is Western medicine. That gray area in between is where most people are. So something's not quite right, but yet they haven't been declared sick yet. So Chinese medicine techniques and or the functional medicine techniques, that's where we're living, is right here, where the majority of your symptoms are, but we can't quite put a syndrome to it yet.
Right.
Yeah.